What is data linkage research?
Understanding what makes poor mental health and what protects good mental health is really important if we are to provide the right support to young people across Scotland.
Data linkage research is a special type of research that we can use to better understand young people's mental health and well-being. Data linkage is when we bring two sources of data or information about the same person together to understand how they relate to each other. This could be information from health records, such as how many times a person's been to hospital, education data, such as your exam qualifications, or it could be survey data from questionnaires that people answer about themselves, such as the Shine Pupil Mental Health Survey. How can data linkage research help us?
Data linkage can help us better understand health and well-being. For example, by linking mental health survey data from young people across Scotland with information about green spaces near where they live, researchers at the University of Glasgow found that young people who live in areas with more green space, like parks and woodland, also have better mental health. This is very important as it means by creating green spaces near where young people live, we could support better mental health.
In another data linkage study, information on sleep was linked to academic performance in teenagers. They found that 16 to 19-year-olds who went to bed before 11 p.m. on a school day had better grades than those who went to bed later. This is important to know as encouraging better sleep patterns could help academic performance.
How does data linkage work? To do data linkage research, we need to have personal identifiers which are the same in the two data sources. Personal identifiers are unique pieces of information about a person that allow data sources to be linked together. For school-age children, this could be your name, date of birth, postcode, or your Scottish candidate number, which every pupil in Scotland is given when they enter Primary 1. How is the data kept secure?
When you give personal identifiers in a questionnaire, these are stored in a secure computer file, separate from your survey answers. This means nobody looking at the survey answers will know it is you.
To explain how data linkage is done securely, let's say we are trying to see how sleep affects attendance at school. Step 1. We need to identify sources of data with the information we are interested in. In this case, it would be sleep data from a school survey and school attendance data from school records. Step 2. Each source of data contains a common personal identifier, such as the Scottish candidate number, which can be used to link the two bits of data together. Step 3. The data is linked to create a new data file which now contains both pieces of information, such as the sleep and school attendance. Step 4. Once the data are linked, the personal identifier, such as the Scottish candidate number, is removed and replaced with a randomly allocated number. The new data file does not contain the personal identifiers, so that it is not possible for researchers to know whose data they are using. Researchers need to get permission to link data files, and they are only allowed to see the information they need for their research, such as data on sleep or school attendance. All data files are kept on password-protected secure folders with restricted access. Researchers follow very strict procedures to make sure that your data is kept safe and secure.
No individual people will ever be identified in data linkage research, and your school, family and friends will never see your survey answers.
Do I have a choice whether to take part or not?
Yes, you always have a choice whether to take part in research. During the survey, you will be asked for your consent to use your answers in the data linkage research. If you decide you do not want to take part in the data linkage research, you can still fill out the survey and your answers will be used to help improve the health and well-being of young people. But they will not be used for the data linkage research.
Thank you for watching.